Imagine a scenario where intimacy concludes in just 60 seconds, leaving both partners frustrated and disconnected. Now, consider the difference when that same experience is extended to 20 or 30 minutes of sustained, confident connection. As a sexologist with 15 years of clinical experience in the Delhi NCR region, I've worked with thousands of men to bridge that gap using medically grounded behavioral adjustments. Reaching that goal requires a two-phase system. We will first establish 3 foundational daily lifestyle changes, followed by a 6-step bedroom protocol applied during intimacy to manage timing in real time. While persistent medical issues always require a direct consultation with a specialist, mastering this 9-step behavioral baseline is the necessary first step for any man looking to regain control. We begin with the daily routine. Success during intimacy is built on physical and chemical foundations that must be established long before you reach the bedroom. Step 1 is a commitment to baseline physical and psychological health. Consistent exercise and a balanced diet aren't just general advice. They provide the cardiovascular stamina and mental clarity required for sexual endurance. Step 2 is the daily practice of Kegel exercises. These are often overlooked, but they are the primary tool for building the muscular strength needed to delay climax. By identifying and regularly contracting these muscles, the same ones used to stop the flow of urine, you are training your body to voluntarily control the pelvic floor, which is essential for managing the climax reflex. Step 3 is optimizing your intake of zinc and magnesium through nutrient-dense foods like leafy greens, nuts, and seeds, or via professional supplements. This focus on minerals is backed by a 2019 study which found that men who reach climax quickly often show significantly lower levels of zinc and magnesium in their blood compared to those with higher endurance. Without this physical, muscular, and chemical foundation in place, the advanced techniques we use during intimacy will have no baseline to support them. Once the daily habits are established, we move to the bedroom protocol, 6 steps designed to manage the psychological and physical pacing of the encounter. Step 4 is the absolute elimination of the rush. This means clearing your schedule, silencing your phone, and ensuring you aren't fighting the urge to use the bathroom before you begin. When you feel hurried, your nervous system interprets that haste as stress. This triggers a fight or flight response that signals the body to finish the encounter as quickly as possible. Step 5 is a mandate to extend foreplay. Penetration should be viewed as a late-stage component of intimacy, not the immediate starting point. Moving too quickly to penetration trains the brain to favor speed over stamina. In contrast, prolonged foreplay helps desensitize the initial panic response, effectively teaching the brain to be patient. Step 6 is a strategic shift. Prioritize your partner's satisfaction first. Use extended manual or oral stimulation to ensure they reach climax before penetration begins. Focusing on your partner first removes the internal pressure to perform. When you know your partner is already satisfied, the anxiety of failing to please them evaporates, which naturally helps you stay relaxed and last longer. When you eventually transition to penetration, we use Step 7, Dr. Imran's technique, which utilizes the pelvic strength you've been building. After entering, keep the pelvic floor muscles pulled tight, as you did in your Kegel training. Maintain this tension while using slow, shallow strokes to prevent overstimulation. Practicing this over several months strengthens the prostate and seminal vesicles, gradually increasing your body's physical capacity to hold back during more intense movement. For moments when you feel you are losing control, Step 8 provides a manual emergency brake, known as the stop and squeeze technique. Withdraw completely at the verge of climax. Have your partner firmly squeeze the area just below the head of the penis for 3 seconds. This pressure helps physically disrupt the ejaculatory reflex, allowing the sensation to subside. Step 9 is the stop and hold, a variation for those who find the squeeze technique distracting or uncomfortable. In this version, you simply withdraw and pause all direct stimulation. Revert to light foreplay or kissing until the intense urge to finish has completely dissipated before resuming. By combining these 3 physical interventions, you transition from a passive passenger to an active driver of your own sexual response. While building long-term pelvic strength is a process that takes months, using the manual breaks in steps 8 and 9 can provide an immediate change in how you manage your timing during your very next encounter. With consistent practice, these techniques eventually become second nature. Over time, you will find you no longer need to stop and squeeze because your body has learned to maintain that plateau naturally. I am currently refining a new drug-free stamina technique that is seeing a 90% success rate in my clinical work. I'll be sharing the results of that soon, so subscribe to ensure you don't miss that update. If you found this structured approach helpful, please like and share the video. Opening up a dialogue about these techniques is the best way to help other men move past the frustration of rapid climax toward a more satisfying shared experience.